how you all are. I hope you all are fine and safe in your home. As we know, in the last talk we were discussing about the disease, right? We have seen the definition of disease also, and as well as seen the difference between the health and disease free, right? Health means being physically, socially and mentally well-being of an individual, whereas disease free, that means a person is only free from the disease. It doesn't mean that if a person, suppose a person is there, if he is free of diseases, it doesn't mean that always, it doesn't mean that he might be happy or he might be mentally okay. So healthy and disease free both are related to each other, but are different, because disease free is the condition when a healthy person should have, but disease free we cannot say a person is healthy. Alright, so next now we are going to see about more about the diseases. So how does this disease look like? Have you ever seen a disease? Have you ever? No. It doesn't look like anything. It doesn't have any physical appearance. But we say if we are facing any kind of uneasiness in our health, then we say yes, maybe some kind of disease or illness is occurring in our body, right? So we cannot say we cannot say that this is how it look like or how it appearance is, but on depending on the symptoms or the signs, which is changing our easiness, which is changing our comfortability. So in that way we can say that is the kind of disease, right? So let us see. We cannot look the disease, but of course the symptoms for the disease we could see. Symptoms for the diseases. Alright. So what is the symptoms? Symptoms you know already very well that it is a kind of sign which is occurring, just like headache is there, stomach ache is there. If malaria is there, then definitely we are shivering, we are having a fever, cyclic fever is there in the malaria. Okay, so that is a kind of signs which is denoting us that or symbolizing us that any disease might have occurred. Okay, so what is the symptoms? First point indicates that something is wrong. Yes, definitely if any easiness is affected in our body, then definitely there is something wrong. In this way we can say कि कुछ तो हुआ है, any problem had occurred. Next one about more about the symptoms. Symptoms are problems. Yes, headache is problem, stomach is problem, fever is problem, isn't it? So symptoms are problems felt and noticed by patient. And definitely it cannot be seen, but it can be felt and is noticeable. Okay. Next example, just like toothache, headache, toothache, most commonly it is occurring in the children's or in the females basically. So that is their toothache. Alright. Now next we are going to study causes of diseases. We are doing that there are various causes of diseases, right? If any disease we are suffering from, then definitely some or the other reasons would be there. That is why we are suffering from the diseases. Just like microbes. Microbes is well known, microorganisms which we cannot see from our naked eyes and is present everywhere in our surrounding, right? So they are causing diseases, isn't it? They are attacking our body in the one or the other way, enters in our body. If our immune system gets weak in front of them, then we suffer from various diseases. What is this immune system? We will study further also, but let me tell you here a little bit. Immune system is the defense mechanism of our body which fights with the various diseases. Okay, which fights with the various microorganisms which may enter in our body. That is why we are okay right now, because even the microorganisms are present, they might be trying to enter our body, but our immune system is fighting with them, and if they have entered also, so our immune system is able to fight with them. So therefore we are healthy right now. Okay, so causes of diseases. First one, human health is affected by various factor or causes. Yes, of course. What are the causes? Causes are of two types, that is external factor is there and internal factor is there. Okay, external as well as internal factor is there. So we will deal one by one all these factors. So first we are going to deal with the external factors. So the first point which deals, that is disease causing microorganisms. Okay, disease causing microorganism. External factor means the factor which is from outside, that is disease causing microorganism. First point already I have discussed, microorganism. Maybe that is a bacteria, virus, fungi, protozoans. These are the various microorganisms. They can attack our body, they can counter our body and cause various diseases. Okay, they will affect the cells. Next is inadequate diet. Yes, as per we have studied that for the healthy being, one should have a proper diet, nutritive diet. Okay, so inadequate diet, if we are not taking the food properly, unnecessarily unhealthy food we are taking. Okay, so it can cause food poison also, like that it can cause, isn't it? So the next point is external factor, that is including the inadequate diet. Okay, this can also occur. Pause. Another external factor is the environment pollution. We are knowing that how this pollution is creating a lot of problem, a lot of health issue, right? Due to the increase in this pollutions, maybe water pollution is there, maybe air pollution is there, or soil pollution is there. So this type of pollution is hazardous for health in one or the other way. Okay, in our India, it is considered Delhi as the most pollutant city of India, is Delhi. Okay, so due to this pollution, various problems, breathlessness is felt, then basically some type of allergens is also caused by it. So many causes are there. Factors are this environmental pollutions are causing a lot of health issue. Okay. Next is the if any person is addicted to any kind of unpreservative things, just like tobacco is there, alcohol is there, drugs is there. So this type of unpreservative things can cause the illness also, disease health also, if the person is very much addicted to it. Just like taking of tobacco can cause the mouth cancer. Okay, alcohol can lead to the damage of liver and kidneys, and then drugs that can, of course, that will damage, that is directly attacking the central nervous system. Its influence is seen in the central nervous system. So in this way the man becomes very much aggressive and can go into depressions, and also this is caused by this external factor. Now let us see what all are the internal factors which can cause the disease. First is malfunctioning of parts. This was the external factor, means from outside how we acquire, from outside how we inherit these diseases. Okay, next one we are saying internal, means body itself is causing some type of within the body. We are not acquiring or inheriting from outside, but it is acquired within the body. Okay, first point is malfunctioning of parts. Maybe if our any body or any organ is not working properly due to one or the other problem. So sometimes heart is there. So hole in heart, you would have heard that. So it happens sometimes during the reproduction process or during the delivery time, some or the other cases are there or complications occurs which cause this types of malfunctioning of parts. Okay, example, heart is there, kidney is there, liver is there, etc., which is not functioning in a proper manner. So that is a kind of disorder for the body, or that is the, we cannot say exactly a disease, but it is badly affecting the body because we are not able to do the particular life activities. Next is the genetic disorders. There are various kind of genetic disorders is there. A good example I'll give you, sickle cell anemia is there. Alright, color blindness is there. Genetic disorders means these are the disorders which is carried by the genes from one generation to another generation. Okay, we are doing that DNA. DNA is a genetic material which is present in each of the cell and each of the human being or each of the living organisms in the world. Genetic material is present. So what happens? This genetic material carries the characteristics of an individual. Whatever the characteristic features are there, that is shown by this DNA. Okay. So what happens? The DNA is having small fragments. All the part of the DNA is having a segmented, means that has been divided into particular segments, which is known as the gene, and this is carrying particular characteristics from one generation to another generation. And that is why we show similarity, some like father and some like mother. Okay, so genetic disorder, so this is the disorder which is acquired from one generation to inherited from one generation to another, just like sickle cell anemia is there. If in ancestor anyone is suffering, then definitely the coming generation will be having the same. Okay, next one is malfunctioning of body immune system. Means if we see that everyone's immune system is not very similar, immune system varies according to the person. Okay, so if the person is having very weak immune system, then that person loses ability to defeat with such type of microorganisms which can cause disease in us. Okay, so therefore this immune system should be strong enough so that the microorganisms can be defeated and we must be healthy. Okay, so but in those cases where the immune system is weak, in that case the person doesn't is not able to fight with those sorts of microorganisms and is suffering all the time with some or the other kind of diseases. Okay. Okay, now let us see about the types of diseases. So types of diseases are various types, but first of all we will decide on the terms. Okay, how long timing, or we can say how long term it takes to finish that disease, or how long it can be on that particular patient. Okay, so on the basis of that we can see two type of diseases are there: acute disease and chronic disease. Acute angle we are studying in the in maths also, acute angle, obtuse angle, and we are knowing that very shortest angle is the acute angle, right? The smallest angle is the acute angle. So within this acute is similarly here also, on the basis of that only the name has been given. This is a disease which lasts long for a short period of time, maybe for a 1 day, 2 day, or maybe 1 or 2 weeks. That's it. Okay, within this 2 week it will become optimized and will become normal. Alright, so acute disease is there. On the contrary, we are having the chronic disease. This chronic disease is just opposite of that. This lasts longer for so many days, for maybe an year, and maybe sometimes it remains for the whole life. Okay, and it is means sometimes it is not curable too. And if it is curable, then also it is having a long term effect on that particular patients. Okay, so let us see one by one. Alright, first is the disease lasts for only short period of time, as per I have told you people, that is the disease lasts for only short period of time. And the next case is last for long time, maybe lifetime sometimes, as per I have told you. Next is don't cause long term and bad effect on health. Yes, of course, for when the person is suffering from those type of acute disease, maybe common cold is there. Okay, so normal fever is there. So within 2 days, 3 days, or it is taking more than week maybe. So within those days it will become okay. That will be curable. So it is not having any long-term health effect. It will not remain for the whole life. That is this normal effect is troubling it for the whole life. It's not like that. It is curable and is not having a bad health effect. Next is have drastic long-term effect. If the person is suffering from this type of chronic disease, or has suffered from this disease, then that effect can be seen in a whole life. That can be drastic, as well as that effect will be very much harmful to that particular person. Okay. Next is example, that is the cold is there, cholera is there, normal fever is there. Alright, within this acute disease. On chronic disease, I have told you it may remain for the lifetime, and chronic disease also include those type of diseases which we can say as a cancer or some type of disorder, genetic disorders, as we have discussed. Sickle cell anemia is there, color blindness is there, hemophilia is there. So those all things remains for the whole life. Okay. Just like most common which is prevailing, that is diabetes is there. We know diabetes patient, and then blood pressure is there, low blood pressure or high blood pressure. In the short form we are saying as a BP. Diabetes means what? There is a lack of insulin, right? Insulin is external insulin is being provided to that person so that the sugar level remains normal. Means those who are having this type of chronic diseases has to take the medicine all time in their life, in their complete life, so that that particular doesn't affect them badly. But of course it is there, and some or the other problems is always arising to those type of people. Okay, so this is the basic difference between the acute and chronic diseases. Okay. Students, in the next vlog we will see, I hope this topic is clear. In the next vlog we will see the more type of diseases, that is on infectious diseases, non-infectious diseases. Okay, we will discuss in the next vlog. Okay, thank you.